There's a difference between vaginal atrophy and genitourinary syndrome of menopause. They kind of could affect how you think about it and when and if you decide to treat for estrogen problems in your nether regions. Hi, I'm your local OBGYN. I love women, and let's talk about it. Historically, we generally referred to loss of estrogen as vaginal atrophy, and it basically means that you have lost estrogen in the tissue of your vagina that is leading to dryness, lack of moisture, lack of stretch. And a lot of the associations have to do with vaginal comfort and intimacy in order to have comfortable sex. But the reality is that not everybody needs the vagina just to feel comfortable for sex. There's a lot of things that are involved with that tissue down there, and there's a lot more than just the tube of your vagina. So when we talk about genitourinary syndrome of menopause, what it is it's a more comprehensive term to describe loss of estrogen in our female pelvic region. It includes not just the vagina, it includes the vulva, it includes the perineum, which is the space between the vagina and the rear end. It includes the pee hole, your urethra, your bladder, the walls of the vagina that sort of connect and touch with the bladder, as well as the area that sort of goes backwards and touches the rectal area, because all of that tissue is totally saturated in estrogen receptors and responds to estrogen. What we know is that GSM, genitourinary syndrome of menopause, is not just about comfortable sex. It's also about having discomfort down in your pelvic region, whether it's just when you wipe, wear underwear. It refers to increased risk of infections when you lose estrogen down there, as well as increased risk of UTIs, which can ultimately lead to urosepsis, meaning a septic bacterial infection related to your bladder, because you are much more at risk for UTIs in that area with loss of estrogen, and that can actually be deadly.